Hello, my name is Dr. Mary Grady, and I'm a nurse. I'm a doctor of nursing, and I work at Lorain County Community College. And the reason I'm here today to talk to you is to teach breast exams or good breast health. And what got me started in this area of wanting to make sure that people were educated on how to do breast exams is when I was in my 30s. And some of you are probably thinking, oh, she's probably still in her 30s. But when I was in my 30s, I had two friends when we were 30, 32 that died from breast cancer. And both of the people that died were people that found the lump by doing a self-breast exam and followed up with a healthcare provider and then got the treatment that they needed at the time. And both parties were people that were younger than what insurance was saying was covered by a mammogram. And so that is the importance of doing self-breast exams at all ages. It's just a diagnostic tool. It's just one of the many tools that you would use to find out if there was a problem. If you find a lump, just know that breasts are lumpy. There's a lot of things naturally that are in there that's all lumped up, and just because you find a lump does not mean that it's breast cancer, but it's something that means that you go to a healthcare provider, either a doctor or a nurse practitioner, to follow up on that. A lot of the sites that you may go to, the American Cancer Society, the Susan G. Komen site, they're saying breast exams are good to use, but they're not the be-all, end-all. So I want to start by saying that. Many years ago, there was a big push to not even teach people to do them because people would find things and then would get so anxious about it, it was causing problems with over-treatment and doing of exams and going to the doctor. But the way I look at this, it's better to be cautious, to find things when it's small, and to get treatment what's needed. So let's get in here to the breast portion of what I want to talk about. And I have these models, and I got these models with a grant years and years ago, and I have used them to the point that they are almost falling apart. But what is a breast? And a breast is made up of many parts and pieces. And I have my little cheat sheet here so that I can make sure that I don't forget anything to tell you in this presentation. One of the things the breast has in there is a lot of glands. And it has a lot of ducts. And the reason it has the glands and the ducts is breasts were made through evolution and through time, year going on. They were designed by nature to be what provides milk to nourishment for your infant. And that is why it's so full of ducts and glands. And then it's full of a lot of connective tissue. There's a lot of fatty tissue that makes up a breast. So you have all of this ductwork, these glands, you have like muscles that are attaching it to bones. So there's a lot going on with these breasts. So no breast is typical or the same. No breast is going to feel the same way. Because of those ducts and those glands, you're going to have lumpy things that you're going to feel all along. So you've got to know yourself, and you've got to know your breast. And that's why you do self-breast exams. So that as you're feeling your breast and you feel lumps, you can tell from month to month if that's a lump that's just there all the time, that's part of the connective tissue, or if that is something that's changed over time and needs to be looked at. So there's a lot going on there with the anatomy. And there's a lot of changes that can take place to our breast too. That's why we have to always be making sure that we're checking them each month, because age changes things, hormones change things. So we've got to be looking at things. When you feel lumps as well, just know that sometimes a lump could be something that's a cyst. It's fluid filled, and that's nothing to do with breast cancer at all, but it's something that you can feel, and you can start to tell the difference when you feel it, of whether it's fixed or whether it's something that moves. Okay? So there's a lot going on here. Now, the other thing about breast exams is the importance to do them, but also the importance of following up with mammograms. And so I want to say that real quick before I get into here. I looked it up here on my phone from the American Cancer Society. And it said that women ages 40 to 44 should have a choice of whether they want to start getting a screening mammogram. But they recommend women past the age of 45 getting one yearly. And so they also say women 55 and older can go to 2 years or 1 year. So it's a lot of conflicting information out there. And a lot of it's going to depend upon insurance. But there are also a lot of things, if you talk to your healthcare provider, places where you can go to get free mammograms if you're not able to obtain one and you would like to. So basically, looking at the American Cancer Society, anybody over the age of 45 should be getting a screening mammogram, okay? Anybody that's younger than 45, they only do them usually if there is a family history of such a thing. So if you have a family history of a lot of people in your family dying from breast cancer, they might start your screening mammogram a little sooner than the typical thing that I saw on this little website here, okay? And there's also, if you're someone that has a family history of breast cancer, they can also check the BRCA gene. Everyone's got BRCA genes in your body that are tied to breast health. And if your BRCA gene has a mutation on it, then that means you're going to be more prone to breast cancer. So we have a lot of good screening tools out there to try to help people with breast cancer. So on a mammogram, I thought this was very interesting. I have this little sheet here from Susan G. Komen. And what it shows here is that when you feel a lump by doing a self-breast exam, it's usually a lot of times the size of a quarter. But if on a mammogram, they can pick up a lump or a problem the size of a dime. So that shows you the importance of both diagnostic tools. Just feeling your way to healthy breast, okay? So how do I do a self-breast exam? Well, the first thing you should do is become very comfortable with your body and actually look. Stand in front of a mirror and look at your breast. What do they look like? Is there any changes? Breasts are going to be asymmetrical. Nothing's going to be perfect, one looking like the other. But when you look at them, does it look like the skin looks normal? Does it look like there's any puckering or dimpling or things that look like an orange peel? That would be a warning sign that there's something going on the inside of your body that needs to be looked at. Because a lot of times when a tumor is on the other side, it may pull and retract something in. So you want to make sure you visually look at your breast to see if there's any changes at all on the breast. The other thing you need to do is raise your arms in the air, put your arms down, do the football hold. And look at what the breasts look like when you do different position changes, because that's going to show you if there's any dimpling or some issues or problems. Then you want to pay close attention to your nipple. Does the nipple, if your nipple has been out and it starts to become inverted or pulled in, that's a warning sign that you need to go see a healthcare provider. If you were born with a nipple that was inverted, and it stays inverted, that's just how your body is. But if you had a nipple that pointed out and then it becomes inverted, that's a sign of a problem. So you need to get some check with a healthcare provider. You also want to look at the nipple and see if there's any discharge. Your discharge, you should have no discharge from a nipple unless that nipple is breastfeeding. So if there's discharge, you want to pay close attention to what the color is, the amount of the drainage, if there's any odor, and that's what you need to go and talk to your healthcare provider about. I always tell nursing students, so when anything in your body is draining, COCA. COCA is what you always look at. What's the color, the odor, the consistency, and the amount? Because those are the things that people are going to ask and want to know the information to. And so after you've looked at your breast and you've looked in the mirror, then you can do this a couple ways. A lot of people like to do it in the shower. And that's why there's these shower cards that you can get from the American Cancer Society and Susan G. Komen that's a reminder that stays in your shower so that you remember to do your breast exam. And your breast exam, they recommend you doing it once a month. So for people who are still having their periods, your breasts are very tender around the time of your period. So you may want to wait and do your breast exam the week after your period so your breasts are not tender. Because one of the things we're going to be looking for is if you feel tenderness. So if you're someone that's past having periods and you're menopausal, then you can just pick a day. And that's the day of the month that you're going to do it. I've met a lot of people that are older that get their Social Security checks and tell me that they use Social Security check day as the day that they remember to check their breast. So it's whatever you can do to try to help yourself remember. So a lot of people like doing it in the shower because they can get their hands all wet, and when the body is wet and your hands are wet, it can glide a little easier. So as you start with the breast, there's a couple different ways you could do it. One of the ways that you'll see is to make circles. And circles means you start at the nipple and you want to use light pressure and you want to go around in circles. Now notice how my fingers are not leaving this breast. I'm going around in circles. And the reason I don't want my fingers to lift up and go back is I may miss a spot. So I want to keep my fingers going around in circles all the way around the breast tissue. And the breast tissue is also up at the top. And the breast actually attaches to your clavicle or your collarbone here. So you want to make sure that you feel right up underneath that collarbone as well, because you could still, there's breast tissue there. So you want to make sure you go all the way up to the top. Now the breast, this breast is misleading because there's breast tissue as well that goes out here on the side and goes up underneath your armpit. So you need to also keep working your way up underneath your armpit so that you can feel all of that tissue and all of those lymph nodes that go up into that area. So the breast is not only the breast tissue, but getting right up here to your clavicle and going underneath your armpit and feeling it. So that's one way you could do it, in circles. Another way you could do this is you could do kind of like what I call mow the grass. If you mow the grass like I do, I like to mow the grass in a straight line, come back, do a straight line so that I don't miss anything. And that would be the same with the breast exam. I'm going to mow the grass all the way up, and then I'm going to go all the way back down into different lines. Just keep on going so that I do not miss a spot. Okay, so I can go in circles or I can go in lines. Those are just two commonly used ways. Once I do light pressure, I want to go back and I want to do a firmer pressure as well and do the same exam a second time. Because the light pressure, I'm going to feel things that are kind of up toward the top. And when I go a little firmer on my touch, I'm going to feel things that are a little deeper. Now notice how I'm using the pads of my fingers to do this. I'm not digging down, I'm just on the top using the pads to press, okay? That's what you want to do a good breast exam. To do a good breast exam, it's going to take a couple minutes on each breast to make sure you covered everything. And a lot of folks say, well, I don't need to do this because I go to the doctor. Well, you go to the doctor once a year for a checkup. This is something that you need to be doing every month. And when you go to the doctor, I don't know about you, but sometimes my exams are not as thorough as the ones I'm telling you to do. So you may want to consider doing this every month yourself as well as a preventative measure to catch any problems that you may see. Okay, so we've got the breast done. We could do it standing up in the shower. You can do it standing up and do your breast exam. You could also do your breast exam. Some people are more comfortable laying down. So you could lay on the bed and you could do your breast exam laying flat. And then they also recommend you turning to your side and just checking the breast as well. Because when you move around, so does the breast tissue, and it lets you kind of get another spot where you could feel a little better. Okay, so women need to be doing this every month. And men need to be checking their breast as well, especially men that have a family history of breast cancer in their family. And there's been the incidence of men catching or having breast cancer has increased over the years. And they think it's because of the family history, but then they also think it's because of a lot of environmental things that are going on. There's a lot of things in our food that mimic estrogen that could cause breasts to start to have lumps and bumps and problems. And then there's a lot of adipose tissue because our society's getting a little larger and our men folks are getting a little larger there. So breast exams is something that men need to do as well, especially if there's a family history. The other thing I would like to point out is there's breasts come in all sizes. And the smaller the breast, it's usually the easier it is to check it. But the larger the breast, especially like our friend Dolly Parton, she might have a little bit of trouble checking the whole breast to see if there's any lumps and bumps and things that she needs to find. So women with larger breasts, sometimes they recommend trying the two methods that I taught you, but also maybe just holding their breast in their hands, holding the top and the bottom and feeling of the top on the way out, and then feeling of the bottom, and just kind of holding it and feeling it that way. If the breast is large enough to hold in that manner to where you've got the breast and you're able to feel the top and you're able to feel the bottom to make sure that there's nothing in the way of anything. So if I find a lump or a bump, I'm going to call my healthcare provider and I'm going to stay calm, because most of the things people find are benign. There's no problem at all. And I'm going to remember where that problem is, and I'm going to every month check to make sure that problem has not gotten any different, that I'm not having discharge from my nipples, that I'm not feeling increased tenderness, that I'm not feeling something that feels like almost like a rock that's fixed, that's not moving. I want to make sure I'm looking for those type of things as well. And I'm going to want to make sure I'm checking my breast. I'm getting mammograms at the time that is approved that we talked about through the American Cancer Society. And I'm also going to want to use some good health practices. And I hate to tell you this, but the way to prevent cancer is two main ways that I am not very good at, but one of them is we're supposed to eat right. We're supposed to eat more fruits and vegetables. We're supposed to cut back on our red meats. And this is a hard thing to do, but it's something we all need to be working toward, is eating healthier, because that is one of the things they have found that's associated with an increase of cancer. The other thing is exercise. And exercise doesn't mean you have to go to the gym and you have to get all sweaty and bang and clang a bunch of weights around. Exercise could be parking further away in the parking lot and happen to walk a little further. Maybe walking up the stairs instead of taking the elevator. It's making movement a part of our daily living so that we're moving so much and using our body, and that's what our body wants us to do, and that helps circulation, and that helps us to prevent problems with cancers. Also, if you're someone that smokes, smoking is never a good thing. Everywhere you read, it says smoking bad. So if you're smoking, you need to check with your healthcare provider and see about maybe getting a patch or ways that you can stop smoking. Because the minute you stop smoking, your body responds to that right away, and it starts to kind of heal itself. So those are very important things that you need to keep in mind and to follow. So going back to this, to recap, check your breast every month. Check it a week after your period is the best time. If you don't have periods, just pick a day that you're going to be reminded to do so. You can put like a card in your shower to help remind you. If you're like me, it's one more thing you have to clean in the shower. So that'll remind you when you have to clean the shower. Remember that when you check your breast, you're using the pads of your fingers. You can either mow the grass or you can go in circles. You want to do a light pressure. You want to do a deeper pressure. And you want to make sure you don't forget underneath your arms, because that's where a lot of lymph tissue is. And you want to make sure you don't forget to feel right up underneath your clavicle, because the breast tissue hooks to that area as well. You want to eat right. You want to exercise. You want to quit smoking. And I think if we do all of that, we'll be in pretty good shape. So I'd like to thank you for tuning into this, and I hope some of the things I said today were helpful. Goodbye.